Hello, hello.
You know what I like that we both did?
What?
We brought a little torso comfort pillow
Yeah.
to our laps.
Mine's a pussy.
Yours is.
Yeah.
Oh, mine's just smiley faces.
Your vagina smiles.
Yeah.
You'll get it if you're on YouTube.
Yeah, you wouldn't otherwise.
Yeah.
I hope. Mine's for my bloatation. My cramping and bloatation.
I get it.
Yes.
Sometimes a little pressure is just so helpful.
I know.
It's so helpful. I'm actually in pelvic PT right now.
Oh, yes.
Because I've noticed, and I have no real words to describe it, so my poor PT who just had to hear me ramble about it. But I feel like pressure in my vulva towards the end of the day.
Okay.
And it's really frustrating. And so the only way that helps is if I like hug a pillow and bring it really close to my body. That's not what I'm doing right now because it's not quite that time of day. If you've experienced this, I'm there with you.
I kind of know the feeling you're explaining because I think I get that sometimes at the start of my period where it feels like my vagina has dropped and or gained a few pounds.
Yeah, it's like it's not painful.
No.
It just doesn't feel normal.
Yeah.
And it's frustrating. It's more frustrating than it is anything else. And so that's just,
Right.
yeah. That was not what I planned on saying.
I was going to say, was that your thing? Because I know you have
It wasn't my thing. My thing was this thought I had when I was in the shower the other day, thinking about my wish for my husband. My wish for my husband, is that if he is ever walking on the street and a TikToker comes up to him and says, "Can you please point out the different parts of a vulva, or can you tell me where the clitoris is?" That he is not a dumb fuck and points to the wrong thing. That is my
really
one wish for my husband.
Were you just thinking of like wishes in general in life, or you were just
that one just popped in?
just like
because I had seen a lot of those that day of like, where's the clitoris? Where's the vagina? What is this flap? And like people just saying the most random shit. And I get it. We have poor sex education. I get it. And I'm not blaming those people. Kind of I am. Kind of. Just a little bit. When they say it with extreme confidence, like when a man says it with extreme confidence that is the clitoris and it is like the butthole, that's when I'm judging. Like, don't have the confidence then.
You don't deserve that at all.
Ask. And it also shows that, like, they're not willing to ask, you know what I mean? Because if you don't know, just literally say, "I actually don't know where that is. Can you show me?"
They just want to shoot their shot.
Exactly.
Assume they're right.
Exactly. But my wish for my husband is that he never fucks up one of those.
Yeah.
And that if I ever see him fuck up one of those,
See him
instant
on
divorce.
TikTok. Oh my God. There was a guy next to me on a plane once, and he was playing one of the plane games, and it was trivia, and it was like just like anatomy trivia, and it was like, how many X chromosomes do women have? And then he like stared at this multiple choice for a long time. And if this were me, and it was a question I didn't know, I would have just exited out of the game immediately because it's embarrassing. I'm assuming people are watching, watching me not know. Yeah. And then he goes, 1. And it's like, no!
Oh, no.
It was really funny.
That's not supporting learning.
I know. But I get it. So when they get things wrong about anatomy in your body, you're like, ugh.
It's like, just say you don't know.
Yeah, just say you don't know.
Yeah, I don't like those kinds of TikTok. Like, I like watching them, but they also make me angry. I also don't like the ones that, like, ask them questions about their partner. Like, when's your partner's birthday? And they're like, I don't know. It's like, you fuck.
Ew.
You dumb fuck.
That's really upsetting.
That's so rude.
I would cry.
Maybe they're staged. I don't know.
Maybe they thought they're being funny.
Yeah, it's not funny, and it would ruin my marriage.
Well, you know what goes along with that? Educating yourself and knowing what's out there is today's episode. See, I just strolled right. I bridged the gap of the divide you were causing.
Yes.
It was embarrassing for you. Yeah. So I just had to create a little walking bridge.
Thank you for building that brick by brick
to today's episode.
So here we are on the other side of that bridge. Today's episode with Dr. Jennifer Lincoln, all about birth control. So this is a topic we've been asked about for a really long time.
Yeah.
Honestly, I'm going to be honest with my perspective on it. I thought like, maybe it's a little too basic. You know what I mean? Like, I wasn't super excited to do this topic. I know it's really important though, but oh my fucking God. Second, I've always loved Dr. Lincoln. That was not a reflection, like my feelings around
I like
the
got
topic.
A hint of her personality.
Dr. Lincoln is incredible. But like, we go into like debunking myths and misconceptions. And I have a lot of myths and misconceptions around birth control.
Well, I think because we both came from this perspective of having a hard time with hormonal birth control. And I'll admit it, I felt all high and mighty, feeling like I know that hormones are bad for your body. Yeah, and like, that's why I don't have hormonal birth control. Like, I didn't say that shit to you guys when I was doing the IUD episode. That's how I felt. Yeah. And that was a dick-ass move of my part. So I am so happy we talked to Dr. Lincoln today about birth control. And it's not fair. Different things work for different bodies.
I was right with your dick ass right there.
Dick ass personality. Yeah.
And I think what's really cool about Dr. Lincoln's perspective is like there is really room for all of it. And whatever works for your body is what works for your body. Like if you're into hormone balancing, going along with your
alert,
cycle.
Whatever works for your body works for your body.
Like fucking go off. There are aspects of that I still love after, doing this interview, but I think it's a really important perspective to take into account. And there's just so much shit.
That is
spouted.
Not fucking true. So I'm so happy we got to talk to Dr. Lincoln today.
Yes. And Dr. Lincoln also introduced us to this really cool resource called Bedsider. And we got to connect with them a little bit. So here is a little clip from them introducing what they are.
Bedsider.org is an online birth control support network operated by Power to Decide, the campaign to prevent unplanned pregnancy. We think you have the right to a healthy, happy sex life without worrying about unplanned pregnancy. You can make that happen by taking an active role in your reproductive health, and we can help. We hope that Bedsider will be a useful tool for folks to learn about their birth control options, better manage their birth control, and in the process, avoid getting pregnant until and if they're ready. One day, we hope everyone has the power to join us in saying, thanks, birth control.
And if that wasn't enough of a selling point as to why you need to check out Bedsider, here's another. They are so cool that they let you engage in a giveaway.
Let you
engage in a giveaway.
There was no smoother way to put that.
They gave us a box full of awesome swag from Bedsider that we are able to give to you, our listeners, if and only if you share this episode to your stories on Instagram and tag us. That's the only way we'll see it. That's the only way we'll know. And the only way you will be entered for a box of swag.
Yeah, if you wanted like a grid post, you're more than welcome to if you want us to be there forever.
Forever and ever. But tag us is the point.
Tag us.
In this episode, yes. I'm so excited for you guys to hear what's next.
Yeah. So without further ado. Dr. Lincoln.
Dun, dun, dun.
I am Dr. Jennifer Lincoln. I'm a board-certified OBGYN. I'm an author. I'm an educator. I'm on social media, and I'm in Portland, Oregon, working as an OB hospitalist and doing a lot of things outside of the hospital, too. So it's super fun, and I'm so thrilled to be here.
Amazing. Well, we're so excited to have you here.
Yes,
and we're excited to talk to you about a long-awaited topic that I feel like Cass and I have been talking about for forever, but waiting for the right person to address. And we want to talk about birth control, birth control options, how it affects us, what we can do with it in our systems, in our life, all of the above. Yeah. So can we maybe start with some myths and misconceptions around birth control?
Yeah. So how many hours do we have?
I know, right?
There are so many. And I feel like it's something very unique to birth control because you just don't hear the side effects of Viagra or, other medications. It's really very specific to birth control, which I think there's a lot of reasons for that. But there's a ton of misinformation. Maybe we can just start with what's kind of hot topic right now, obviously, is abortion and reproductive rights. There's a lot of misinformation that some people think that birth control causes an abortion, specifically the IUD. And that's totally not true at all. Right. But it's definitely something that people have this hypothetical idea that maybe it could, and then they want to use that as a reason to legislate away access to some kinds of birth control. So that's a little shady. It's the suspect. I think just in general, there's a huge misunderstanding of how it works, what it does, and then there's just this whole backlash against birth control. And this idea that it's unnatural. I think that's the biggest thing, which is so unique considering when birth control came out in the 1960s, it was seen as like this revolutionary thing, like this thing that gave us freedom. I mean, imagine living in a world where you didn't have access to good birth control and then all of a sudden it existed. Like, holy geez, you know, and now it's like we've gone back in the other direction where we're like, no, it's evil. It's not natural. It's going to kill you. Get off of it. And I think the biggest thing to understand is that birth control is neither good for everybody or bad for everybody or wonderful or horrible. It's like it depends what works for you, individualized for you, just taking into account what your goals are. So it's there's not a one size fits all. So these huge myths and misconceptions, they're just not nuanced, and so they're always wrong because they're never specific, which I think is really the key here. That it's about what is right for you.
Right. Is it then the same with the idea that it's harder to get pregnant if you've been on birth control?
Okay, so that's a great one. So talking about, that's a huge myth that birth control will leave you infertile. And I joke with people, I'm like, it does. It causes infertility while you're using it, and then it stops. Like, that's the goal when you're using it. But no, so we have lots and lots of good data. And I think that something people forget, and I don't expect them to know this because most people don't dive into this level of research when it comes to something, but birth control is extremely well studied. It's probably one of the most well studied medications that we have out there. And for good reason, because it's important that we make sure that it's safe. So no, they've looked at people who use no birth control and then people who did use birth control, all different kinds, and looked at how many of them got pregnant 1 year later. So either 1 year after stopping birth control or just 1 year having unprotected sex. The pregnancy rates were exactly the same. So there's absolutely no cause of infertility. The only one that's sort of like a temporary, is the Depo-Provera shot. That can take you a bit longer. It can actually take you up to a year for your cycles to come back. That's normal. We know that. That's why if you want to use a birth control method and then be able to get pregnant right away as soon as you stop it, that's probably not the best method for you because it takes a little while to get out of your system. But all the others, your fertility is right back to your baseline. So, and I also, sometimes what blows people's minds is that some of them are actually protective of your fertility, because let's say you get pregnant and you have an ectopic pregnancy. That actually, and you have to have your ovary removed. That's going to affect your future fertility. But if you're on birth control and your chance of even getting pregnant is lower, that's actually protecting you. And the IUDs, one of the ways that they work is they thicken the cervical mucus. So they're like a little roadblock. So things like not just sperm can get up there, which is wonderful. We love that. But they also block out potentially some infectious causing bacteria and viruses. So things that could lead to inflammation in the fallopian tubes, could lead to infertility, actually can't get in there. So I like to turn it on its head and be like, actually, it might be the other way around. But it doesn't matter how many times I say this, you guys, people still think it. And that myth, I feel like it will never die. So I'll just keep making TikToks about it every 3 months and we'll be good.
Right. Well, I feel like because that's the only argument I've heard with birth control and with getting on birth control or staying on it. It's like, yeah, but I mean, you're going to risk potentially, if you want kids, having a harder time, and you really got to plan for that. And it's like, I'm literally on birth control to not have a child.
Exactly.
I'm not thinking about that.
Your eggs, they're doing their thing. They only have so long of a lifespan. They are going to be there to be used or not. It's not like they sit in the freezer while you're on birth control and either are better, when you get off it and there's more of them, or they're destroyed at a higher rate. It's it doesn't matter. It just does not matter. So I know that is just one of those, it just won't die, that myth. And it doesn't matter if you've been on birth control for 10 minutes or 10 years. It's the exact same thing. Okay. Maybe one day we'll get there if we start teaching medically accurate, comprehensive sex education in schools. We can dream. A girl can dream.
A girl can dream.
You are blowing my mind, because I'll be the first to admit, so much of the content I've consumed over the past couple of years has been demonizing birth control. And I've gotten to a point where I am terrified of hormonal birth control. And I've tried multiple hormonal birth controls. I was put on birth control pills at 13 for acne and bad periods. And so I want to get into that a little bit as well. But
totally.
I have had so many struggles with hormonal birth control that I'm just terrified of it at this point. But it's that's the only perspective that I am consuming. And hearing you talk about I am a trained researcher. And so hearing you talk about research, I'm like, oh my God. Like, how can I go against like things I'm literally trained in? I know that
and
like
it's so hard when you're served that content and all you hear, right? It's like the Yelp reviews. It's either it's amazing or it's terrifying. And it's never like the vast majority of people who are like, it's cool, you know, like I'm fine. Or, you know, this pill didn't work for me, so I switched to the ring and it's great. But the stuff you see on TikTok, the stuff that goes viral, which annoys the crap out of me, you know, it's all the stuff that birth control will make you depressed, you'll lose your sex drive, you'll gain weight, you'll develop cancer, of course. Infertility, you won't pick the right partner. Like, I don't know, like climate change, like everything gets And I say that because I'm like, yes, of course, individually, we should talk about all these potential things for you, but it gets blown out. And it's always put out there by people who have no medical training, who use their N of one. So as a research, you know, like one person's experience is totally valid for you, but not to generalize it.
Right.
And then it's people who don't know how to present the data correctly. Like I'm sure you've seen like birth control causes breast cancer. Like that's a huge one out there that I see. And technically that's true. It's like one extra case of breast cancer in about 8,000 people. And if you're younger than 35, it's one extra case in about 50,000 people. So if for you, that's like just too much, that's scary, then of course don't take it. But when you think about the risks of like what we do every day, like that's actually a pretty low increased risk. And what they always never tell you is that it also significantly decreases your risk of ovarian cancer, colorectal cancer, and cancer of the uterus. Like those are always just left out. Like sometimes we literally put people on birth control to prevent cancer of the uterus. And so, but that's not hot and sexy, right? That doesn't like go viral. So instead it's birth control will give you cancer. You know, it's listed as a carcinogen. Yeah, cool. So is sunlight, but we don't stay in our basements all day because of it. There's a way how to use it safely. There's risks, there's education. And so often social media like that doesn't translate. And then all this misinformation stays up, and that's why I'm on there and I have a job. So
yeah. Well, I've totally been the person to be like, well, my experience with hormonal birth control, and then be preaching like the bad word against hormonal birth control, because I have had friends, you and I included, that have like had poor experiences on hormonal birth control. But again, that doesn't mean that that's everyone's experience. And I've had people talk to me about how it's like completely changed their lives. And, you know, I mean, you speak from what you know.
It's like you said, your experience is valid for you. And it doesn't mean, the term that I think it's thrown around a lot, and I think it's used incorrectly, is gaslighting. Because people will say, well, you're gaslighting those people who have bad experiences. And not at all. Again, your experience is valid for you, but we can't use everybody's personal experience as a point of counseling when it comes to understanding risks and benefits. Just like for me, I've had 4 IUDs and I love my IUDs. I will go into the grave with my IUD at me. Like, that's how much I love it. That doesn't mean they're right for everybody. And it doesn't mean that just because mine was awesome, if somebody had a bad experience, I'm going to be like, well, that's not true because mine was fine. Like same thing on the flip side. So it's just about understanding, personalizing it, taking everything with a grain of salt. And what I am most concerned about in a post-Roe America is the number of people who continue to put out really bad, non-evidence-based, fear-mongering content about birth control now more than ever. I'm like, you guys, this is like, have you read The Room? Like, this is not how we should be doing it right now. It's so scary. It's so scary. And people are like, well, it's not natural. And I'm like, lots of things are natural, like arsenic and COVID. And like, we don't love those. Just because something's natural doesn't mean it's good. But...
like arsenic and COVID. I have one more myth that, unless you were going to.
The only thing, you keep blowing my mind. Like the connections that you're making between talking about like the revolution that was birth control and now really going backwards. And I feel like we ask the question a lot, like, well, how did we get here? Like, how did we lose this? And it's like kind of no fucking wonder we're here when we're talking about like birth. I don't know. We're going against the things that got us to where we are now. And that's fucking scary.
People, like, it's also really important to understand that birth control came from a kind of a not a great place, right? The people who it was studied on, the way it was done, there's a lot of bad juju there. When you think about racial things, you know, people in Central America, like, we can totally own that and be like, that's not cool. And we can also own that we're here now, and birth control is a life-saving medication for a lot of people, just like insulin. And you do not hear like the all natural crowd being like, not big insulin, you know, like there's just, and I think that a lot of it is really, it's about patriarchal control of women Like, I don't think it's a mystery that we are seen as women. We're not supposed to get pregnant. We're not supposed to need birth control, right? Only sluts need that. Just keep your legs closed. I mean, I see those comments every day on my social media when I'm talking about abortion or birth control, coming from men or coming from women who just think, it's purity culture. So birth control is already seen as this like extra thing that only bad girls need. And they ignore the fact that we need it like for treating bad periods or endometriosis or cancer prevention. They don't care about that. That's expendable. Same thing in the abortion debate about, like rape and incest, whatever. Like how often does that happen? So it's about control. And I think it's another way of doing that. And the thing that breaks my heart is when I see women doing this to other women, especially these like hormone experts, like, they're like, well, I'm selling this supplement and it's made by a woman. And I'm like, it is even more gross when women are putting out crap for other women. It's bad enough when the men did it, but now to like be doing it to our own, like it's not empowering. It's even worse. But yeah, so it's knowing how to recognize what's reliable, what's not, which can be really hard when you're on TikTok or elsewhere, or you've just never been given the language to know or to ask like, what's your background? What is good data? It's really hard.
Totally. Well, in that point too about Viagra, it's like the slut propaganda goes to women who are trying to not get pregnant, but it doesn't go to men who are trying to like have more erections. Like,
oh yeah, like been on the commercials, right? How many Viagra commercials we've seen for a long time, right? Or mail order Viagra, insurance always covers it. But heaven forbid you say vagina, like, oh my God, but yet we love erections in this country. We just don't like what it could lead to. And somehow that's our fault. Like, no thanks.
Yeah. But that totally reminded me of that feeling when you would pick up your birth control at a pharmacy and like that little twinge of shame that you would feel when you were like, thank you. And I don't know that like, I never really marked it as feeling a little like, shamey, not necessarily from the person handing it to me, but just society in general. And
I remember going down to the county clinic and getting my little bag of free birth control. And I walked out feeling like, it's like, oh my God, they're going to think I'm just the biggest whore. Like, and I also used to hate going to the store and buying tampons too, which is hilarious as a gynecologist now. Like that was another thing, you'd pick out like which cashier was like a female and young and you'd like hide it.
Yeah, you'd sandwich it between like salami and your bread.
Exactly, I know.
A tampon sandwich.
I know, totally. And salami, like I love that you went there. Like, yes, it just makes sense.
I'm hungry. That's so
but
funny.
It's all the same. Yeah.
Yeah. The last myth that I was thinking of is it not being good for your body because it stops your periods. And hearing that the period that you do have on birth control isn't a real period.
Yes.
That's why
those are two awesome ones. I love that. So let's just start with it's not a real period. Some people are really obsessed with that. They're like, this is not a period. Stop calling it that. And I'm like, what is a period but a withdrawal bleed? It's a bleed when your hormone levels go down, whether those are your own or hormones, what we call exogenous hormones that you take from birth control. It's the same exact physiologic process in terms of your uterus goes, oh, bummer, there's not a baby here. No progesterone to support it. And then you have a period. So whatever people want to call it, I'm like, it's like, saying, I don't know, like any other two words that are related, like it kind of means the same thing. And I'm like, your body doesn't give a shit. Like it's the same thing. And then the first one of like, it's, the fact that it's like not natural or good for your body to not have a period. Well, remember, we've never menstruated this much in like history because we've never lived this long. And most of the times we got married, we were like 14, we started popping out babies every year. And then we died like usually during childbirth, like the age of 25 or 30. So we have never menstruated more in our lives. So it's kind of a new phenomenon that we're having this many periods. And it's okay because actually every time you have a period is what puts you at risk for ovarian cancer. It's because that egg bursts and that follicle has to fix itself and stuff can go wrong there. That's why when you take birth control for 5 years, you decrease your risk of ovarian cancer by 20%, and that accumulates for every 5 years that you take it. And that protection lasts after you stop the birth control, as opposed to the breast cancer risk that we talked about. That goes away, right after you stop taking it, but the protection part actually persists when it comes to other cancers. So once again, natural isn't always good.
Mm-hmm.
And we know too that the most dangerous thing the majority of us people with the uterus will ever do in our lives is give birth.
Right.
It's extremely dangerous, and I'm not out here to say that the vast majority of people do fine. Of course they do. But if you want to talk about danger and what's one of the most natural things you can do, get pregnant and have a child, that's the riskiest time of your life. And especially when you talk about things like blood clots, because people will say birth control causes blood clots. Absolutely, it raises your risk. But when you compare it to pregnancy and postpartum, it's a fraction of that. So it's just important to again, have a full conversation, which a lot of people, when they're trying to sell you, they're like natural detox supplement, whatever. They don't tell you that part.
Right. Damn.
Yeah. I have another myth question. And this one, like, I don't really want to ask it because it makes me nervous because it's something that I've really liked. But this idea of hormone balancing, that's something that I've consumed a lot of over the past couple of years. And this idea, like, that's very anti-birth control. I would say at least everything I've consumed in that realm is very much like, get the fuck off the pill. You're ruining your life and your body. And I also think, like, it feels really comforting because it's like, here's what's wrong. This is going to fix every aspect of your life. Your sleep, it's going to fix that. Your body, it's going to fix that, like air quotes around that.
Totally.
All of those things, all of your health problems, everything. This is why those things are happening, because you're meant to live in rhythm with this thing. Can you talk a little bit about that?
Yeah, no, totally. And you are so not alone. I mean, I see so much hormone balancing stuff on TikTok and I always stop and I'm like, what do they mean? Because I don't know what the hell they mean when they say that, because the normal, like you said, it's not like we fluctuate, right? We have different levels of estrogen, progesterone, all the time. And certain ones are higher than others, depending on where you're at in your cycle. But this idea that, like, let's talk like Jolene Brighton. I don't know if you've ever consumed any of her content. She drives me bananas because she sells her book and she talks about like all these protocols and supplements and diets and the method and the whatever. And it's not based in any good science. Because if it was, like, we would be talking about that. But this idea that there's like estrogen dominance or progesterone dominance, like, and trust me, I have contacted all my friends who have trained with people on social media who are like actual physicians and fertility specialists. And I'm like, did I miss the day in training when we were talking about estrogen dominance? Because everybody's obsessed with it. And I don't know what the hell it means. And the answer is that it's not a real thing. Like, it's just, you go and you take these quizzes and they're like, well, if you're bloated this day and you have a headache this day, then you're in this dominant state and you need to eat these seeds. And it's really, at the end of the day, what it's about is, if you do what you're supposed to do, like you eat your fruits and your vegetables and you get good fiber and you exercise, like, you're probably going to live longer and your hormone levels are probably going to be what they should be. But taking birth control to like either suppress terrible cycles or to not get pregnant is actually a much more consistent state than the enormous fluctuation you're going to have when you are pregnant. And if what people are really talking about is, I guess, the only real imbalance I can think of, which is like polycystic ovarian syndrome, where you're not, or some other sort of anovulatory state, we should get to the bottom of what that actually is, as opposed to labeling it with this like weird diagnosis that nobody who practices medicine uses that terminology. So I think it's a lot of woo-woo. I think it's a lot of Jolene Brighton. It's a lot of Gwyneth Paltrow. It's a lot of like, they're out there to sell you something. And I think that's the biggest thing to note. Are they selling you a program, a book, a supplement, a detox, a cleanse, a masterclass, a whatever? Because if they are, and they can't give you good references or resources, and they're not actually trained in that, those are huge red flags. But we see this all the time. I've seen these like cycle syncing nutritionists. That's my favorite. I don't know, what the hell is that? And to make it so complicated, right? I feel like as women, we're always told all these things we're supposed to do, right? You pee after sex just in case. Do this just in case. It's all these just in cases, and they all add up. And like, please stop telling me that I have to eat chia seeds in a certain time of my cycle in order to like maximize my sex drive or my whatever. Like, it's just, if it was evidence based, we would be talking about it. So yeah, I think it's a lot of woo-woo.
Yeah. Well, I really appreciate your response on that. And what you were saying about it being complicated, it is so complicated. This list of foods that you eat at this certain time, but this part of your period's only 5 days. So you're going to have to go grocery shopping again at this point. And it's like, as somebody who has struggled with disordered eating, nothing has been more triggering than trying to cycle sync my nutrition.
I 100% think that. And this is exactly why I get so angry, is it preys on people's vulnerability. What it's really based out of is, and I'm sure you felt this way, but you didn't feel heard by your doctor or your healthcare team. You're like, nobody's listening to me. And I 100% think that's a problem. And the blame is on us. The blame is on the insurance industry that lets us have 12 minutes with patients. There's a lot of that. But the solution is what came out of it is the extreme, right? Like these, well, I'll listen to you. I'll take care of you. It's where a lot of naturopathic medicine has, I think, started out in really good intentions, and it went a little crazy. And this isn't the first time we've seen this. I mean, you go back and Google like snake oil, and you remember like in the 30s and 40s, these people would be going around and they'd sell these elixirs, and it would fix everything, right? Like, and we laugh at that. We're like, oh my God, they thought that drinking that. This is the exact same shit, just in a really cute bottle with some awesome Gen Z marketing. And now they have an Instagram account. Like, it's exactly the same thing. It's preying on fears. And the problem is we need to do a better job listening, meeting people where they're at, educating, so that people don't feel like, well, the only other solution I had was to go see somebody else who's, yes, their office is amazing. It's hour appointments. I get free tea. I get a massage. They listen to me. They actually know who I am. I would go for it too. I get it. I totally get it. But then they took it and they ran, and they're loaded. They make so much money off of this because it's not covered by insurance. One of the biggest things we hear is, well, you're in Big Pharma's pocketbook. And I was like, God, I wish. Like, my loans, you don't even want to know.
Please, I fucking wish.
So bad. It's so bad. And also, you can look all this stuff up and see how much people get paid. And I think I got $200 in the past 5 years, but whatever. It's cash only. They make so much money. Oh my God, so much money. And so when people are like, Big Pharma, absolutely Big Pharma is screwed up. But big natural and big hormone and big supplement is so messed up, because it preys on people, just like you said. And it makes me so angry, because I have gotten so many messages from people who are like, I stopped my birth control because I saw this TikTok, and now I can't go to school because I'm bleeding all over the place. Or worse yet, now they're pregnant and then they can't get an abortion. Like, I just think it's so irresponsible. Let people make decisions for themselves, what's best for them. Give them good information. Don't scare them into one or the other.
Right.
It's so bad. And they won't get sued. They don't have to deal with it, right? They don't have to deal with the consequences because they're not physicians. So they can sell their program and then they can just go on. I don't know how they sleep at night. I really don't.
That is a completely different view than I've heard, and I feel like it's just so trendy right now.
It
that
is.
Like, you only hear people like doing the temperature method too. I want to get into different types of birth control after this, but like the temperature method, the hormone balancing method, all of those things. And it is a scare tactic in a way, where you do hear like, are you tired of your mom hating you? You should go on.
You should probably work on that in your ovulatory phase. Probably shouldn't talk to her then.
Also, don't move during these 3 weeks because it's bad for your cycle. So
don't make any left-handed turns, like car accident. I know. Could you imagine? Oh my God. And I will say the fertility awareness method, which I think can be a great method for people if they do it right. And I made a YouTube video about it. And I want to say it's like 20 minutes long. Like, it's not short, because it's not just like check your temperature and it's cool.
Right.
Like, there's a lot you need to do it correctly. And if you do it correctly, it can work really well, but it's not for everybody. And the fact that they're the people who are talking about it are like, this works for everyone, or you should just do that. Like, it's so weird, because you're like, wait, so you don't want the birth control pill to be one size fits all, but you're saying this will work? Like, no. And again, it's weird. That trends every few months. And it's so weird that it popped up right after Roe fell. I'm like, really? Y'all, this was the hill to die on right now? But still tell people to go do this. Like, no. You got to lock down a good, really good, easy method right now.
It's not easy. I've tried the fertility awareness method, like through Natural Cycles, I think was the brand that I use. And I've heard great things about
FDA
Natural
clear.
Cycles.
They're great. Yes.
But I will say, you have to take your fucking temperature. Like, you can't get up and go to the bathroom and then come back and take your temperature.
You can't, fart the wrong way or sneeze.
No.
It's like so
literally.
Yes.
It has to be so fucking perfect. And as the way my brain works, I couldn't do it. It did not work for me. I think I had like one day where I maybe did it right. And it was like this just isn't for me. I know that they paired up with like Aura Ring, which like you automatically does it, which is really cool.
Yeah, that's a very cool advancement. I will give them that for sure.
That's something I hope to try in the future, but that's a very expensive investment. And so fertility awareness method is not just like this accessible, easy. It's free because you just take your temperature. It's not fucking easy.
Well, let's be real. Who are the majority of these people making these TikToks, right? They are white, usually pretty well-to-do, middle class or above, very privileged women who are like, well, of course you can check our temperature. Like, you know, how about the people who like work night shift or already have 2 kids? They have to get up in the middle of the night, like don't have regular cycles. Yeah, you're going to buy like that ring is expensive, really expensive. So like, it's very privileged to think that because something might work for you, it's going to work for somebody else. And for those that it works, awesome. But like, don't think that it's just so simple, you know, it's really hard. I couldn't do it.
I'm way too forgetful to do anything like that. And then this is dealing with pregnancy.
Because I was forgetting to take my pills on night shift as a resident. And I was like, now would be the worst time to get pregnant. And so 2 days later, I was like, you put that thing up in like, let's call it a day. We cannot.
Let's call it a fucking day.
Exactly. I was like, not today.
Well, then let's dive into different types of birth control. And we've talked about hormonal. I would also like to know if the non-hormonal has all of these same great benefits. So yeah, let's go into the different types of birth control we can use.
So I think, you know, it's really good to break it down into that like hormonal and non-hormonal. And my favorite website to get information from, I'm not being paid by these people, is bedsider.org. They really have I just love how graphic it is. Not that makes it sound like it's pornographic, but how visual it is, I should say.
Yes. We were just looking at it before this.
Don't log on. Great. Yeah, but it's just so easy because you can pick different methods and you can compare them based on efficacy, how they work, how private they are, what they cost, if you need to do anything. So I love that. So if you're thinking, how do I start? I think that's a great place to go. And I would back up actually and say the first thing you should think is like, are you done having kids or you don't ever want to have kids? Because if you are sure, 110% sure, then doing something permanent like getting your tubes tied, or if you're a guy getting a vasectomy, those are awesome. Please do not consider them reversible. Like TikTok is obsessed with vasectomies right now. And they're like, well, you can just get them reversed. It doesn't always work and insurance doesn't cover it. It's a really difficult surgery. Imagine trying to suture back together like 2 spaghetti noodles and like hoping that works and that sperm, you know, transmits through them. It's not easy. So if you want something that works, but you don't want something permanent, then doing the hormonal versus non-hormonal, you know, kind of separating it there, I think is helpful. And when we're talking about non-hormonal methods, the most effective is the copper IUD. It's a set it and forget it method. It's good for up to 12 years. The only little about it is that you do have to go in and have a procedure to have it placed, and your periods can be heavy or a little more painful if you're already prone to that. So that's oftentimes one of the number one reasons people will discontinue it. But for people who like it, like they love it. And it's no hormones. And again, all these things, fertility right back to baseline. And then you've got your other things, your barrier methods like internal condoms, external condoms, diaphragms, what else? Cervical caps, the withdrawal method, which don't do that. It doesn't work that well.
My PE teacher was like talking to us about like sex ed. He's like, the withdrawal method does not work. That's how I got him, and pointed to his kid. It's just like,
and
okay.
Also, if you're a female, you're putting your trust in your partner, and like, I'm sorry, in that moment of heat, like, do you really trust them to, you know, like, it's, you know, and that's why having Plan B or Ella, an emergency contraceptive on hand, is always a good idea. But that's a topic for another day. And then when it comes to hormonal methods, there's a lot, and that's why it can feel overwhelming. And that's why I think going through something like Bedsider and comparing them can be super helpful, because you've got pills, you've got patches, you've got rings, you've got injectables, IUDs, the arm implants. Out of all the hormonal kinds, the IUD and the arm implant are the most effective with a failure rate, meaning you get pregnant of like less than 1%. So that's amazing. That's like as good as getting your tubes tied, which I think is super cool. But it doesn't mean other methods can't be good for you if you are somebody who remembers to take a pill every day or change out your ring or, you know, that kind of thing. So it's just figuring out what works, and you can trial and error. You know, you might find one thing works, or again, just because it works for your best friend doesn't mean it's going to work for you, and vice versa. So like, sometimes it can take a little while. But I think just being informed going into it can be helpful to kind of guide the discussion. And what I think too is like, if you're somewhere where you can't access care, what can you get mailed to you? Like, I love mail order birth control. It's legit. It's safe. There's tons of options right now in the United States. And there's good screening. It's not like you just like order this random stuff. Like there's good screening methods to make sure that it's safe for you. So I think it's another awesome option that was not around when I started and I had to go to that county clinic and like take the bag and like feel ashamed, which I should not have been, but that was back in the 1900s. So, life was a little different.
Are there negative side effects worth considering when you are picking a birth control?
Totally. Yeah, totally. And so I think, it's important to say, what am I concerned about? And then what's most likely? So what do we always think about, right? I think one of the biggest ones is weight gain. And I don't think that's vain. I think it's totally fine to think about that. And I think it's really important to know that the only birth control method that has been scientifically linked with weight gain is the Depo-Provera shot. And it's not in everybody. And it's usually in the first few months. So if you've been using it for a while and you're good, then you're good to go. And we think it's through how it changes your appetite, not how like your body holds on to calories. So if you can be in charge of what you eat and make good choices, then you should be good to go. That said, I know there are people who are like, I don't care what you say about the science. Nothing changed. I started, let's say, on the pill, and 3 months later, I gained 30 pounds. Well, then I'm just going to listen to you and be like, okay, we should switch something up, But so I can tell you what the science shows and what the data shows, but if you yourself have an issue and something doesn't work, then we should try something else. It shouldn't just be like, well, deal with it. I'm not going to change it because I'm going to hold your birth control hostage. Another reason that mail order birth control is awesome. Then yeah, I think that when we think as physicians about, side effects, that we think about the bad things. So for us, the biggest thing when it comes to hormonal birth control are increased risk of blood clots and strokes. And that's something that's very real. And the conversation I have with people is, let's check and see what could make you high risk or you shouldn't have something with estrogen in it, because it's the estrogen that's the troublemaker. So if you've had blood clots before, a certain kind of blood clots before, if you have a certain kind of migraine, headache, that can put you at an increased risk. If you're of a certain age and you smoke a certain amount, or if you have a family history, those are things that would make us go, we should avoid estrogen in you. But all told, even in people who have none of those issues, they could potentially still develop a blood clot. Those increases are pretty small, and once again, so much smaller than the risk that you'll get a blood clot when you are actually pregnant or postpartum. So it's all about understanding kind of the relative risk is what we say. I think that's one of the biggest ones that people worry about. So yeah.
When we are going through our options, like how do we walk into that scenario? Because I know that trial and error can feel so intense. Like if you have an error with a trial, it's either gaining 30 pounds, having horrible periods, acne, like anything that just like feels like isn't you anymore. So how do we walk into this situation without going through intense trial and error?
No, I think that's a great question. What I would say and how I approach it is I say, what's your biggest concern? Because then it's very different for different people. If some people say, I cannot handle having bleeding in between my periods, like that will wreck their lives. They'll feel like they can't be spontaneous with sex. Then I automatically will say, okay, we are not talking about the arm implant because that's not going to work for you. Let's talk about something else. Or if somebody says, I'm really worried about weight gain, then I'm probably not going to try Depo. If it's acne, I delve a little more into their history and I try to understand, like, is it hormonal acne? Is it other things? Should we get a dermatologist on board with us? So I think it's really about identifying, like, what are your biggest concerns? And then narrowing it down from there. And what I do tell people is that usually you do want to try to give it about 3 months, any method, to like let your body adjust. But I also want people to know there's an out before then, knowing that maybe they would have done fine if they waited. But again, you're not going to force people to wait. And to know that, like I said, what's the number one thing you're concerned about? And then what's our backup plan? If we're like, this is not working, okay, we're already going to know what we're going to try next. And I do think that, remember that a lot of people, when they're using birth control, when something's not working, or that's what we tend to talk about more. It's like the same thing with birth horror stories, right? People just want to tell you, like, my vagina filleted open, or, like, I needed to see, like, that people are like, it was fine. Hurt a little bit. Like, we tend to only hear the bad sides. And a lot of people are like, yeah, I started on the vaginal ring and I like it. Cool. Like, nobody makes a TikTok about that. So I think it's just important to, like, level set and just know that it's not always like it's going to take 6 years before we find your method,
Right.
I think that's important. Yeah.
Wow. I know there's so many things. Are there any like good doctor screening questions that should be asked when you're considering birth control?
Okay, I love this question and I hate this question because in my mind, I'm like, everybody's wonderful. Everybody can talk to their doctor. Everybody's doctor feels like like a best friend.
Right.
And I think that I'm a realist because I've gone to some of these asshole doctors and I'm like, what do you say? Do not talk to me like that. Or, and I know that they're out there and it sucks, but I know that there's also so many amazing ones. So I think that, honestly, people are like, how do I find somebody who I know is going to be evidence-based or not force me to try this for 6 months or something. I really do think there's a huge benefit to word of mouth. Who does your primary care doctor go to? Who does your best friend go to? That's how I feel like people find so many good people. But I'm going to tell you that my favorite little secret trick is you call labor and delivery of the hospital in your area, because those nurses see us in our worst moments, 3 a.m., exhausted, stressed out, a baby's trying to, whatever, in emergencies. They see us at those moments. And so they know who's cool, who can you talk to, who talks to patients respectfully, who's funny, who's relatable, or who's a total jerk. Cold call them and be like, I'm looking for a new OBGYN. And they'll be like, okay, honey, here's who you want to see. Here's who you do not want to see. They will tell you. They will. And I love it because I hear the phone calls sometimes and I just laugh. So I think that's the top secret trick is that call your local labor and delivery and they will dish.
That's a hot tip.
That's a hot tip. That's a sneaky back door to the truth.
Because you want to know why? Because again, and I'm a doctor. I'm not going to put up with it, idiots. Because I know how bad some people can be. I also know how amazing they can be. And I've had some amazing doctors. And I want that for everybody. I don't want to gatekeep that. So that's how you find them.
That's good. That is really good.
Yeah.
Because they probably have this much time for your phone call. So it's I'm going to tell you exactly where you need to go.
Because you're not calling to be I'm the 7th patient who's coming in tonight. So trust me, they are
God, I could be done with you.
Yeah.
They're so thrilled. Absolutely. And I do want to say, let's say you see somebody or whatever. If they suck, fire them. Don't go back. Don't feel bad. Don't be oh my God. Even if you're switching to somebody else in the office, we don't care. We're busy. Trust me. And or people should be with different personalities. Not everybody is for everybody, and so it's fine. It's like dating. Do not do pity dates. Don't do pity doctor visits. It's your vagina, it's your uterus. You get to decide who helps take care of it. And I think that's really important. And if you feel like somebody's not listening, I also love feedback. And even if you're too afraid to say to the doctor, I don't like how this went down. You can always send a letter. There's an office manager. I think feedback is great.
I'm terrified of feedback, but I'm happy for you.
Exactly. Reason number 7 why I will not be returning to you.
Yeah. But that's so true. I do think about that. Even if my doctor's just busy and so I go to a different doctor, I feel so guilty and I hope I can sneak into the office before they come out. It's I promise I don't hate you. Okay, bye.
It's I actually love you.
Right,
Please don't quit on me.
Yeah. Please don't quit on me.
I know. And I think it's so hard, right? If an office, if you can only get in, they're okay, we'll see you in February. And it's July, you're that's not going to work for me.
I have a yeast infection now.
Yeah. And I will say too, if your doctor is trying to withhold birth control, because there's a huge misconception that you need a pelvic exam or you need a pap smear to start birth control. You do not. Unless literally replacing an IUD, we need to be sure. But no, and this is again why mail order birth control is amazing, because I've heard from so many people on TikTok who were yeah, my doctor said I have to come in, or they'll only write them for 6 months or a year. They won't refill the prescription until they come in. And then you can't get in for 3 months, and then you're knocked up and you're coming in for a prenatal visit, which you don't want to have to do. Yes, there's screening we should do, in the perfect world, but even the American College of OBGYN says you don't need a pelvic exam unless you're having issues to start or continue birth control. And if your doctor is being an ass about it, well, that's why mail order birth control is so great. So many reasons. There's so many workarounds, and I'm hoping that physicians and healthcare providers, as they're seeing this, it's not to replace them, but it's an access issue. And I'm hoping that one day, and I think one day soon, we'll get birth control over the counter too, some forms of it, because it's, Tylenol sends more people to the emergency room than birth control does. But you can imagine politically why that will take a while, but I hope we get there. So
that scares me. Yeah. Wow. Oh, those
Could you imagine just going to CVS and you're ding,
that would be so nice.
And in some states right now, they have pharmacists prescribed, where I am in Oregon, Colorado, or the pharmacist can like write the prescription and give it to you, which again, same amount of screening, super safe. We've studied it. There's no increased risk of, any bad side effects when we do it that way. We need to break down barriers, because if we want people to really feel that they can have the birth control that they need, we need to inform them correctly. We need to make sure they're getting good counseling. And then we need to make sure that there's access there, because people need to take control now more than ever.
I did not know that you could do that, or that pharmacists can do that.
Yeah. Well, here's the fun thing. It's only in some states, and and not all pharmacists know this, even in those states. So that's a
well, there's a hurdle. You just walk in. No, you can write that for me.
I promise.
Yeah. They're like, no, honey, we only do Viagra. We don't do that.
I can give you Viagra.
Yeah.
Okay. Take what I can get, I guess. Thank you. I'll also take some salami and bread.
Yeah.
Right.
While I'm here.
I'm just going to go pre-bleed in the aisle right now.
Don't mind me.
That's what the bread's for.
Yeah. Salami while I wait.
See, basically, we've now tipped over into my YouTube of like things not to put in your vagina, and definitely like a baguette would be one of them, I think.
Yeah. That wouldn't be very soft either.
Ew. Gross. If maybe your birth control fails, or you're not on it, and you find yourself in a bit of a predicament where you want plan B, or you want, I think Ella, is that another one you mentioned?
Yeah. If you're in a pickle because of a pickle. So,
right.
yeah.
Because I remember, like, I took it at 16 because I didn't understand how to use plan B. And I thought that my own, like, wetness was him coming, like, breaking through the condom and getting me pregnant.
I've got our plan B right here. I just keep it on hand.
Oh, beautiful.
Yeah.
I was just in Texas, and I was like, hey, what do you guys think this is?
Right.
What
do you think this is? I didn't know. And like, and I just took this, I feel like pretty serious of a pill, not knowing what it was doing other than like, can't be pregnant now.
Right. Yeah.
But I have no idea what it is.
Is that so emergency contraception is the overarching term. And there's 3 different kinds. There's the copper IUD, which is actually the best kind, but we won't talk a whole lot about that right now. But it's really when people think of Plan B, which has a bunch of generics, right? Like My Way or the Highway, I don't know, My Way or One Choice or whatever, and then Ella. And the good news is that both of them are really super safe medications, and there's like no medical reason you can't take them. So it's not like taking them, like, oh my gosh, you could have had a stroke or something like that. And also none of them like will harm you, mess up your body, that kind of thing. So they're pretty safe. And I tell people they're a plan B if your plan A messed up or you didn't have one, and they work by delaying ovulation. So if you've already released an egg, like, I'm sorry, it's too late, but they delay ovulation. The sooner you take it, the better. Plan B is over the counter. There's no age restriction. There's no gender restriction. So anybody can get it. Unfortunately, in some pharmacies, they're behind the counter. So there's that shame factor of like, like, I hate that. They should just be like the Tic Tacs, quite frankly.
Right.
But whatever, but you can get the mail order. So again, I love that. And a lot of companies, mail order birth control companies, when you get birth control from them, they will put in free Plan B, which I love that.
Wow.
I love it.
What a treat.
And you can have both this, or you can get the other one, Ella, which is prescription only, but you can get it mail order. Have it ahead of time, have it filled, have it in your medicine cabinet, lasts for a year or 2. And if you don't need it, then maybe a friend does. And really, because time is of the essence, and it's always like 2 a.m. on a Saturday night. And if you're waiting, you want to get Ella, which works better. It works at higher weights. It works longer. If you want to get that, you're going to have to wait to call your doctor and get a prescription and blah, blah, blah. So have it ahead of time and know that it doesn't cause an abortion. If you're already pregnant, it's not going to do anything to a pregnancy. Whether or not you would want it to, it doesn't matter. It's not going to. So I think it's great, especially if you're using some of these less reliable methods like the withdrawal method or condoms or, the rhythm method or fertility awareness, and you're like not so great at it. Totally have one in like every drawer of the house, quite frankly. Love them. And there's no, there's no risk in taking them too often. If you find yourself taking them all the time, like, yes, they don't work as well, you should get a Plan A, but just know that like, another thing I've seen on TikTok is like, it works less well the more you take it. Like, totally false, complete lie.
I have 2 questions. One, how long do you have to take it? Like, I know sooner the better, but how long do you have? And then I know you mentioned weight limits. What are those? And if you are over the weight limit, do you have any other options?
Yeah, totally. So with Plan B or the generics, you have 3 days or 72 hours. But with Ella, which is the generic name is called ulipristal acetate. That's why we say Ella.
I get it.
You have 5 days or 120 hours. So, both are great, but if you're out longer, and then the weight thing is a huge issue. So with Plan B, it probably it's less effective above about 155, 160.
Less
pounds.
Effective?
I know. Yeah.
That is
and a study just came out.
That's like
I know it's like a regular human. I know.
Greater.
Exactly. And a study just came out looking at double dosing it, thinking that would work if people took 2. And unfortunately, there was no difference with 2. And weight is not the best thing, right? Because you can be 165 pounds and be like solid muscle, or you can not be. And the reason that matters is because it has to do with how the drug is distributed in your fat cells. So weight is like a guesstimate for how well it will work. But so if you're over that, Ella is better. But once you're over about 190 pounds, Ella is less effective too. And across all weights, the copper IUD is the most effective. And weight does not affect it. So also important to take into account where you might fall on that spectrum, which one you might want to have in your medicine cabinet. But yeah, I know it's
good Lord. I was in my before I went through puberty and I was running and doing soccer every single day, I was already at 140, and that was at 16.
Right.
That is so unfair. I had no idea that there was a weight limit to Plan B and how small it was.
I know. And I mean, they're working on, they're studying it. They're trying to better, figure out better drugs and better doses. But and that's why, so if you are you do not want to be pregnant, honestly, the copper IUD is the best one. It's a less than 0.5%, even a little less than that failure rate. And you have a Plan A moving forward, but that assumes that you can get in, you can be seen, you want that. So, And then just to throw this in here, I know we're not talking about this, but I think an important distinction between medication abortion pills, there's no change in efficacy with weight. So I think that can be reassuring that, your weight doesn't affect all medications and their dosing, if that makes sense.
I'm about to ask a really big question, and maybe this is a different episode, but just in terms of I'm realizing what types of abortions are there? How does an abortion happen?
Yeah.
I've never personally had one, but I would really like to know for if I ever do.
No, I do. I think that is, like you said, a whole episode, but the quick answer is there's 2 ways. There's medications that you can take, or surgeries or procedures that you can have to empty the uterus. And as you know, we are in a world right now where it's hard for some people to access both of those. And so the nice thing about medication abortions is that they can be done in your own home. You can get them mailed to you. You can actually get them in all 50 states, even in the ones where they're not technically allowed, through mail forwarding or through getting them from an international prescription. And if anybody's interested, I founded a website where you can figure that stuff out called 3forfreedom.com, all spelled out. And that's actually a hub where you can get mail order birth control, emergency contraception, and medication abortion pills. And I'm not making any money off of it, or not selling anything. It's just like a hub, a directory. And those are FDA approved. Medication abortion pills are FDA approved up to 10 weeks. And it's a combination of 2 different medicines, one that stops the pregnancy from growing, the other one that causes the uterus to contract. Super successful, super effective up to 10 weeks. And even beyond that, you just might need extra doses. And then the surgical methods require you to go in, and to have a visit. And so for some people who are in states where they have to travel, they just can't access that. And it's a real problem. But if you want to know what you have access to, again, 3forfreedom.com can get you that information, and also abortionfinder.com. And if you want to know different information, Safe to Choose is another great website that talks all about what is it, how does it work, what are the side effects, what to expect, because I think it's important to know, again, where you can get safe and legit information, not coercive or information with an agenda. So.
Right, absolutely. Thank you for touching on the more intense aspect of it. I would love to do its own justice with those topics as well, and in a different episode. But I do think it's important to couple it with birth control because, you know, like we say, if birth control isn't always effective, there needs to be Plan Bs, literally. So
yeah, totally.
Ooh, mind blown this episode. Good Lord.
Thank you so much. Yeah. Where can our listeners continue connecting with you after this episode? I know you've named some different places, but
yeah, so I'm on YouTube and Instagram and TikTok at Dr. Jennifer Lincoln, Dr. Jennifer Lincoln. And you can also sign up for my website, drjenniferlincoln.com. You can sign up for my mailing list there. I'm also going to start putting out a podcast in the next few weeks or months or so. So just because like there's not enough to do in the world, but it's still in the, gestating phases, the pregnancy, and I haven't birthed it yet. So
that's so exciting. The only phrase that came into my head was fully torqued, and that is nothing to do with this episode.
The shock on your face.
I know.
That I saw your brows furrow, like come together and then release as that came across your mind. I watched that happen.
Well, I felt bad. I was like, this is my time. This is right when I start talking. I open up the ender. And sounds like I'm about to do something dirty to this.
Close her out.
And I felt disappointed, like I was going to let you down because that had nothing to do with this episode.
That would never let me down. Anything you say with enthusiasm would never let me down.
I love to hear it. Well, I'm fully torqued for Dr. Lincoln.
Torqued or torqued?
Torqued.
What is torque? What is it again?
Torque? I know that people use that to describe a boner. I'm fully torqued.
Really?
Yeah.
Who's using that with you? Because if your boyfriend is saying that, find a new one.
I'm fully torqued for you, babe. I'm torqued.
Okay, fully torqued. Let's go.
Hop on.
Before
I'm torqued.
I lose it.
What I was saying is, I'm torqued. I'm fully torqued for Dr. Lincoln, and thank you so much for being here today to talk about birth control, get us informed, debunk the shit ton of myths that have been weighing the world down, basically.
And my pussy.
And thank you to our listeners for tuning in.
Yeah, and don't forget to do our little giveaway with Bedsider.
Yes.
Share this episode on Instagram.
Mm-hmm.
Tag us.
Let you be a part of this.
In us. I feel like that's a great ask for this episode.
Yeah.
So we'll ask no more of you than to help yourselves get this sick-ass swag from Bedsider. It's like wine glasses, T-shirts, a hat. It's everything you would ever need, actually. And a pin.
Cool.
Yeah.
All right.
Sorry if I ruined the surprise. I don't know if you were going for a surprise. You don't know what it looks like. You actually have no idea what it looks like.
Let us let you have fun and go enter the giveaway.
Yeah.
All right. We'll see you next week.
Bye.
Bye.